Hi, I'm Dr. Josh with Highlands Wellness and Sports Injury Clinic in Kanata, and I'm going to take a couple moments here to show you two drills that I really like to use to improve thoracic or upper back mobility. These can be really helpful around the house when we're picking up something from that high cupboard, or even when we're reaching backwards, maybe in the car to grab something off the back seat. We need to be able to move through our upper back. During sports, we need upper back mobility to follow through on the golf swing. You need it to follow through on your hockey shot, and you need it to throw a ball. Not to mention swimming, biking, every other application as well. So these are really helpful for a lot of people in the clinic because most of us do work jobs that are a bit more sedentary. So we're sitting more, we're in a lot of thoracic flexion. We're just not going through all the different motions. And this is two little drills I like to use to get people moving through their upper back a little bit better. And I often use it as part of a rehab program for shoulder health, upper back health, neck health. So a lot of different ways we can apply this and get patients feeling better. The nice thing about these two, they're really simple and they don't take very much equipment. For the first one, we'll have ourselves our handy dandy foam roller here. And I'll just show you how to quickly go through the drill on the foam roller. Basically, you're going to roll out your upper back and then you're going to try and create a little bit of extra motion in the upper back once we're on the foam roller. I'll demonstrate that, and at home, you're gonna have to go a little bit by feel, but that's all right. I can guide you through it if you have questions, or you can always come into the clinic and we can work it through as well. Anyways, be careful getting on the foam roller. I don't want it to slip out from underneath you. I don't want you to fall on your upper back. That usually doesn't make it feel better. So we get into the right position here, which is basically just upper back on the roller. So what we can do to actively create some more extension in the upper back is hands behind the head, set the roller up in a spot that's kind of sticky, and then just start working our upper back over that roller and repeat that a few times. The next drill that I really like as well is the cat-cow or the thread the needle. So some of my patients are gonna laugh because I use these very often in the clinic. But when it comes to training the upper back, I'm a bit more specific with my technique. So the normal cat-cow is this tabletop position, and then you arch up like a cat, and then you arch the other way. When I'm trying to train a cat-cow specifically for upper back, I usually widen up through the knees, sit down on my heels, and you might notice I kept my hands the same spot the whole time. And now from here, I can really target the upper back with that same cat-cow drill. As you ease into this, you'll notice it gets a little bit easier to work through the upper back. From this same position, I can target the upper back with some rotation, hand on the head, rotate down, and then come all the way up as best you can. So I like these because they are really simple, but they're also pretty specific to our upper back and shoulders, which really is what we're trying to train with these drills. So for all of those, it really shouldn't take you more than 2 or 3 minutes to go through each one, and they can be done daily. They're very low impact, they're pretty comfortable, and even with pain, as long as the pain's not really crossing like a 4 out of 10, these can be some of the movements we do to actually desensitize upper back, shoulder, neck pain as well. If you have questions, please let me know. We're here at the clinic, 329 March Road, Unit 212. We're more than happy to help. We'd love to hear from you. Cheers.